So, welcome everybody. Thank you very much for inviting both of us. We'll introduce ourselves shortly. My name is David Pencheon. With my colleague here, Sonia, we on and off for 10 years started the Sustainable Development Unit for the NHS in England, and latterly for the NHS and Public Health England. And I now work elsewhere, as does Sonia. I actually work in the University of Exeter in the medical school. So I'll just briefly hand over to my colleague Sonia, who will tell you a little bit about herself too.
Hello, yes, so I'm Sonia Roschnik. I'm delighted to be with you and to do this session with David. We're sorry that we can't be with you in Australia, but this is second best maybe. And yes, I also worked for the Sustainable Development Unit for a long period, and then did a stint with Healthcare Without Harm as Climate Policy Director, and now I'm setting up the Geneva Sustainability Centre, which is part of the International Hospital Federation.
Great, thanks very much. So what we'll do is we'll chat with each other as naturally and as validly and as accurately as we can in the next few minutes. And we hope that you'll find this useful, and we'll try and frame the conversation accordingly. But also, if things arise which you want to tunnel down into a bit more deeply, or you want to comment on, I'm sure there'll be opportunities for you either in the chat box. And I think that we'd be delighted to take emails afterwards if there is something that's really burning that you want to take up with us. So I'll kick off and ask Sonia a sort of starter for 10 really, which is, although we looked as though we had a strategy and we looked as though we were organized, we were actually, over the years we sort of led the unit on behalf of the NHS. But I suspect there are some things we were really glad we did by luck or design. And I wonder, Sonia, if you could just reflect on some of the things that really were worth reflecting on and learning from and sharing now, because I suspect some of those lessons are as valid today as they ever have been.
Yeah, thank you. I mean, I guess when we first started, I remember the context was quite different, and it was a little bit harder to engage with people on the topic. And a lot of people were still quite skeptical about what climate change really meant. We were lucky because there was the Climate Change Act that had been put in place in the UK, and the NHS had decided that it needed to do something about it. And when we were faced with this sort of thing about, so how on earth do you get started? We thought a carbon footprint might be a good place. And one of the things I am so grateful we did when we started off with the carbon footprint was that we decided to do a carbon footprint of all the things that the NHS influences. And that is exceedingly important, because it really takes it into the realms of a system-wide transformation, because you're looking at not just the buildings or the energy, but you're also looking at the products and the way services are run. And in fact, it took us down all sorts of interesting avenues, because we found out that pharmaceuticals was huge, even if some people didn't like that answer. And that medical devices, there were a lot of things within healthcare that were specific to healthcare that contributed to this carbon footprint. And if we'd only done a scope 1 or scope 2 carbon footprint, we would have stuck very much to just green buildings, and that we would have done the whole topic a misjustice. So
yes, that's interesting. I mean, my memory of that is very similar, and I think one of the issues I think we spent about a quarter of our very small budget on research in the early days, and I think that issue that Sonia refers to there about generating some oh my goodness facts, so that people will think, gosh, this is really important, this is really big, this is potentially addressable, and it's central to the way the healthcare system works, is very important. You said a little bit about engagement there, Sonia. Do you want to expand a little bit on how we tended to engage with people? Because we were dealing with a very diverse population of, and although this was predominantly the health and care system, there was a huge diversity of people and responsibilities and values therein. So do you want to say a little bit more about our engagement tactics?
Yeah, I mean, and I think these are still very relevant today, that you can only take people on a journey or work with people on a journey if you know where they're at to start off with. And that really implies understanding what their perception is, where they're at on the journey, and maybe what might be the points of influence or the points of entry, we sometimes call them. And what we found is that people had very different ways of engaging with the topic. And sometimes the words climate change weren't the favorite ones, that we used other mechanisms for engaging and discussing things with people. I think the words climate change and the fact that the climate crisis and health crisis is much more recognized now, so that may be less of an issue. But the concept that people may be at different points on the journey, may have different levels of understanding, and that if you would want to work with them, it really requires a little bit of starting in their shoes rather than just blurting out what you know.
Yes, I think that's true. It was a big learning for me that I come from a background of being slightly preachy and soapboxy about this whole issue. And I very quickly, I think, learned from many people that this wasn't a particularly productive thing to do. And in a sense, as you know, we're both ex-clinicians in a sense, we should have known, well, I should have known better that, you know, that old adage that if you listen to your patient long enough, they'll tell you what's wrong with them. But I wasn't applying that in this situation, but hopefully we did. I certainly changed quite a lot in terms of listening to people about those so-called entry points, in terms of, you don't want to break the law, you don't want to break the bank, you don't want to break your social contract with the people you purport to serve. So there are a huge number of different ways of which coming to this issue. So, and I think the lesson for me was you've got to try and combine the diversity of approaches into one core vision, one golden thread, however we called it, rather than something which I still spot a lot and worries me a lot, which is a lot of people who are equally concerned about the ecological crisis, essentially saying my part of the crisis is more important than your part of the crisis. And that's tremendously sad, really, because I think we all have a lot more in common in this journey than we do in terms of our differences.
I agree. So David, if I put the question back to you, what do you think were some of the key points on our Sustainable Development Unit journey that you remember well or think are particularly key?
Well, I mean, one of the things, it sounds so obvious, but it's obvious now. It wasn't obvious then. I mean, initially, I always talked about this issue as a sort of ecological crisis or a climate crisis or a nature crisis. But of course, I should have stumbled onto the fact this is a health crisis, talking about it in a language with words that made sense, that were real to the people who we were trying to help or facilitate or accelerate or whatever. So that was one of the first things. The second was that I thought that there were some people, some professions who would be better at this than others. And I was completely wrong about that too, in terms of it was often people's values and the way they shared their values with other people, often quietly, persistently, meaningfully, relevantly, practically, that really mattered. And I think looking out into the NHS, it was very true that in a sense the future had already arrived, except it was very unevenly spread. There were huge areas, huge numbers of really great things going on, but people were so busy doing them, and they were very different things. They hadn't had a chance to sort of shout it out and say, why don't you try this? And I think that was one of our roles, which was to identify good practice and say to other people, you can do this if you like.
Yeah, I mean, I agree with that sometimes we worry, or I've found that people worry that you need to understand it fully before getting started. And I think one of the key messages is that there are so many actions that can be taken now in so many different directions. There's a lot of no regret measures. We do not need to dissect it fully or even have a perfect carbon footprint to get started. There's something about starting where you're at and then piecing all the different elements together, because I'm sure that in Australia you've got, well, I know you have lots of examples of great practice, and there's something about how you can shine the light on those and use those to embed it into the way things happen everywhere now. I think one of the things at the STU, I don't know if you remember, David, but we were in a way collecting all these flowers in a field, and they all were a bit different, and they were all shining a different sense and a different way of looking at things. And that gradually the Sustainable Development Unit really tried to get it much more embedded into the structures of the NHS and the very decision-making processes. And I guess that's part of what we all need to do, is to pull these elements of good practice and use them to turn them into more systematic decision-making processes.
Yeah, that's very true. But I mean, one of the things I particularly remember when people were reluctant to move, and I think this especially applied to doctors, is I think we all look for excuses not to do things we think we ought to be able to do. That sounds very rude, but I think a lot of professionals are very technical, and they need to have this feeling. We have this feeling we need to understand everything before we can act. And of course, that is a bit of a disaster in this area, because essentially we're surfing a wave. We've got to find the opportunities, we've got to create the opportunities. The world changes very quickly right in front of our eyes, and we've got to be able to grasp those opportunities, be it the crisis of COVID or the crisis of plastics or whatever it is, and incorporate it meaningfully into the collective narrative. So I think it's not about knowing exactly what to do and then doing it. It's about an evolving journey. And I know that things that you were very central to, Sonia, like the designing of the route map, maybe you could just talk a little bit about why having a route map was very, in a sense, very useful, but very comforting for people, to give them permission, to give them guidance, to know where they were on a particular journey.
Yeah, I mean, thank you. It's true that when we first started, we had done the carbon footprint and we'd started identifying actions, but we very quickly realized that this was going to be a long, drawn out transformational journey, and that we in the health sector, we're not great at thinking about the future or how we can influence it, or actually be part of creating a scenario that might be different to the one in which we're heading, steam on. So the roadmap was really about trying to identify some of the key elements that would need to happen across the system in order to get to a better place, to what a sustainable health system might look like. So we had identified aspects around engagement, be that with the public or with oneself as an individual, aspects around governance and standards, and then innovation, of course, and models of care, what might need to be transformatively different. And in this route map, we had identified what you might do at early stages, middle stages, and later stages. So very much recognizing that you could start at any point and then try and move across, just like you might be. I think we used to wonder whether they looked like lily pads on a pond that you were trying to move across on. But the concept that there is no one way to do this is quite important, but there are a number of different elements to try and weave together, and that we do need to think into the future is quite important. And I very much recall that we would laugh occasionally saying, well, in the NHS, the future is about 2 hours away. Yeah,
absolutely. Yeah, and thinking strategically was thinking about tomorrow. Yeah, absolutely. So can I just take you back to something you said a few minutes ago, Sonia, where you were talking about, you don't have to bang on about climate change. There's a lot we can talk about. We can frame this in many words, in many ways that are more relevant, less frightening. And one of the things I think we were called on to do a lot was about looking at leadership, how people led. And I remember we had these phrases like, well, leadership is at every level in every organization. It's not just about the people at the so-called top of the tree. So do you want to, perhaps you could say a few words about how we incorporated leadership development into our function?
Yes, I mean, of course, everybody's a leader at every level and can take forward great changes, and that's so important. But one of the things we did realize is that if the head of an organization did create the right environment for their staff to be able to lead in, it would make a huge difference in this space. And so we did recognize that board members, chief executives, non-executive directors had a key role to play in asking key questions and getting people to think about what it might mean for their organization. So we developed some board workshops, fundamentally, really, to try and start teasing out how this is climate change or environmental sustainability or sustainable health systems are actually very, very much aligned with where a health organization needs to go. And that it's by aligning it and by integrating it that you can create the right environment to move forward. And I think that still applies today. It's probably even more so today with the pandemic, and the fact that there are so many different elements that leaders have to contend with, that trying to pull that all together so that it's not separate silos, but that they form a common vision and strategy is incredibly important. I'm excited by the fact that the leaders of the future have got an incredible opportunity really to do things quite differently.
Yeah, no, that's good. That's great. I mean, that resonates very much with me too, in my memory of it all. I think those points about aligning it with other priorities of an organization or a clinical team or a ward or a hospital or a health center are very important. And it sort of reminds me of some of the issues we had when we were trying to engage people, when I was trying to engage people, especially at board level. I remember doing lots of board development days with various boards. And it was only until I think some of the key individuals found they could talk about this within their remit, within their scope, within their role, this is a quality of care issue, or this is a duty of care issue. So you're not taking people away from their core mission into this rather odd thing called the climate journey. You're bringing the climate journey into their role. And I think that was we were lucky that I was lucky I stumbled on that sort of better narrative for doing that.
And what makes it really relevant, I think, to me today is that actually, because the whole of this is accelerating and becoming even more important, there is something about really embarking on what that leadership journey looks like. And I think there are incredible opportunities to shape the future, to really create it in a different way. I was going to say we had the luxury of time. We obviously didn't have the luxury of time, but now things are, the requirement to really seriously address this is not questioned as much. And there is something about how you really get into systematic implementation. And that is an incredible opportunity. I find I'm hoping that we can all support each other and learn from each other as we go forward.
Yeah, no, those are fine words. The issue about aligning and mainstreaming it is an important one. And I think in Australia, it's very important because I know a lot of people in both at a national and a state level in Australia are working very hard to establish sustainable development units or their equivalent. I mean, context has changed. It'll need different forms of engagement and metrics and what have you. But I think one of the things I remember we used to do evaluations occasionally with the people we used to work with, just to make sure that we were doing as much as we could, and accelerating and amplifying the things where we did add value and stop doing the things that weren't really very useful. I remember somebody once saying, all you need to do is exist, because existing gives me permission to mainstream this in my organization. So I think it's worthwhile, those of you who are worried in Australia about, for instance, the expense and complexity of setting up a unit. It needn't be complex and it needn't be expensive. Actually, we were very rarely over about 5 full-time equivalents in the unit. This is for a staff of 1.3 million. So it being a catalytic, but embedded within the system enough that you understood how change happened, but sufficiently boutique or unique that you had a really important value added to what is high quality health and care for the system. It was
we were very much of the system for the system, and that was very important when it was set up. It wasn't part of the Department of Health. It was very much within the structures, and I think that was incredibly important, because we were with everyone trying to do this, not doing a purely top-down kind of approach.
Sure. So we've only got a few minutes left. I just wanted to ask you a final question, Sonia. A lot of people are often very willing and keen to act, but they will say, well, we need to get our own house in order first. We need to understand exactly what it is we need to do. We need to predict exactly what the effect is, the cost effectiveness of our actions. What sort of things do you say to people who want to be perfect before they put these things into practice?
Well, I mean, the future isn't perfect for one. We we're all shaping it as we go along. And so it's better to get started on things that we know can make a difference. And all of us can get started in different places. But I do think that if you are one of those people who loves to measure and track, make sure that you report it very publicly so that others are engaged on that journey with you. I would say that there's always a place where we can all start. And if you are hesitating, I would just look at your own sphere of influence in your own role and what it is that you touch upon where you can make a difference, because there's always ample opportunity, and we don't have to know whether it's X amount of carbon tons that will be saved immediately. That will come.
Yeah. Absolutely.
What about you then, David? What would be your core message back?
Well, very similar to that, in fact. I mean, I think one of the core messages I would have that I hope would complement what you've just said, Sonia, is the fact that this can be a very lonely business in a very big system when we're all incredibly busy. But one of the things I did remember a lot was when people would phone me up from a hospital somewhere and said, oh, I'm the only person in XYZ hospital who takes this seriously. And I would look at the database or the people we worked with and think, well, there's so and so and so and so and so and so. And they said, gosh, I had no idea that chief exec or that finance director or that any statist was equally concerned. So part of the journey is doing what Sonia just said, which was just go for it, get out on the dance floor, because you may be surprised by how many other people will think, oh gosh, well, if they're going to do it, I'm going to do it too. So that's incredibly important. So
that's a famous quote. We just need to mention it. You don't always need to know all the steps ahead of time. It's your willingness to engage with the music and step on the dance floor.
Yeah. So it is very important. And I think you have got sometimes to wear your heart on your sleeve and say, I don't know what to do. I don't know the best thing to do, but I care about this. And ask for help, because it's very unlikely people will see you nowadays as a crank. Not that, I mean, not that
if they do, it doesn't really matter.
It doesn't matter. It's their problem, not ours. Anyway, I hope you've all found this very interesting and useful and entertaining or whatever. But if you do have any further questions, or if you'd like to pursue any of these points a little bit more, I'm sure Sonia or I would be very willing to receive your emails. And so good luck with the rest of the conference.
Yes, enjoy it, and hopefully see you another time.
Yeah.
Bye.
Okay, bye.
Good to speak to you.